Bismillahirrahmanirrahim. Uh, Now our topic of discussion is anterior compartment of forearm. We will talk about the muscles of anterior compartment of forearm in terms of their nerve supply, actions, and their attachment. We look at the functional organization of the anterior and posterior compartments of the forearm. Our forearm is between the elbow joint and the wrist joint. That area is known as forearm, and this area is also known as antebrachium. Arm is known as brachium and forearm is known as antebrachium. Between the elbow as well as the wrist, having two bones in this region, radius as well as ulna. Already we have discussed. Radius is a lateral bone and ulna is a medial bone of the forearm. And if we look at the section or transverse section of the forearm, what we see, this is a medial bone ulna and this is a lateral bone, and in between them we have a connective tissue layer which is connecting two bones known as interosseous membrane. The term inter means between and osseous means bone. So a membrane present between the bones known as interosseous membrane. So this interosseous membrane is mainly the separation point between the anterior compartment as well as the posterior compartment of the forearm. So if we look at our forearm is covered by the skin on the outer aspect. Below the skin is separation in deep fascia. From the deep fascia, if you can see, the fibrous septa enter and attach to the bones on the radial side as well as on the ulnar side. So these fibrous septa are known as intermuscular septa because they are present between the muscles. So we name them as intermuscular septa. These intermuscular septa attach to the bones, and in between the bones are connected to a interosseous membrane. So these intermuscular septa with the interosseous membrane separate the anterior compartment with the posterior compartment. So deep fascia is surrounding the bones as well as the musculature. From the deep fascia, intermuscular septa penetrate in and attach to the bones on the ulnar and radial side and in between the interosseous membrane. So that's how the anterior compartment and posterior compartment is formed. Before we move to the forearm muscles, just something. Long names guide to the location and function of the or attachment to the muscles. We can take help with the names to identify their location, their attachment or their function. Like superficial or deep, depending if superficial means they are superficial or near to the skin, and deep they are away from the skin. Radial and ulnar, if the muscle is toward the radial side or the lateral side, it will be radial. If the muscle is on toward the medial side, it will be ulnar. In the same way, if some muscle is starting as flexor, means its main function is flexion, or extensor, extension, adductor, adduction, abductor, abduction. The muscles which are starting with these flexor, extensor, adductor, abductor are showing their function also. Does it act on the thumb, pollex or the fingers digits? If we have a term digits or digitalis, means it is related to the digits of the hand or foot, and in the same way if it is having pollices or the term pollex, means it is going towards thumb. They can guide us towards their attachment or their location. Radius and ulna, as we have said, that it is a lateral bone, this is the medial bone, and in between them they are connected to a membrane which is known as interosseous membrane. So this membrane is not only providing connection between two bones but also separating the anterior compartment with the posterior compartment, and also this membrane giving attachment to the muscles of anterior and posterior compartment of forearm. The previous view was the supine view, and now we can see the pronated view. So two movements we use for the hand. One is known as supination, which is a normal natural position where palm is facing forward, and the other is known as pronation. Pronation, the dorsum is facing forward. So how the dorsal is facing forward? That if you can appreciate, the ulna remains on its position. Only the radius rotates upon ulna. So the lower end, initially the radius lower end is present over here as in supination, but in pronation, it from anterior part of the ulna moves towards the medial side. So rotate the forearm and in pronate condition. So that we will discuss in after covering the lectures. Now, if the hand is moving toward the body wall, that is adduction, or it is also known as ulnar deviation because ulna is present here. This movement is known as adduction of the hand or ulnar deviation, and this movement is abduction or radial deviation. For the fingers, if we completely make a fist, means we are flexing our fingers, so that is flexion. If our fingers are straightened up, that is extension. If our fingers are separating apart, that is abduction. The central axis is the middle finger, and if the all fingers are attached together or nearby, then it is known as adduction. Flexion of the fingers, extension of the fingers, abduction and adduction. For the thumb, if we move the thumb towards the palm, that is flexion. If we stretch it up, that is extension. If we touch the little or other finger, that is we are counting, like we are counting the fingers. So we can touch the thumb with this finger, this finger, this and this. That is counting. So that movement is known as opposition. It is a combination of, if you can see, we are flexing plus we are little bit internal rotating. So flexion and internal rotation is actually the opposition. And if we keep the hand with the direction of the fingers or attach with them, that is adduction. And if we increase the diameter or straighten up the thumb upward, that is abduction. Now we start with the muscles of the anterior compartment. The anterior compartment has muscles which are arranged superficially as well as deep. Now we are talking about the muscles which are arranged superficially. We have pronator teres, flexor carpi radialis, palmaris longus, flexor carpi angularis. Pronator teres, as the name is indicating pronator, it means it will perform the function of pronation. It has two attachments, a humeral and ulnar. On humeral, it is attached to the medial epicondyle of the humerus, and on the ulnar to the coronoid process of ulna. From two bones, it is taking origin, and it is inserting on the lateral aspect of the shaft of the radius. The main nerve supply of the anterior compartment of forearm is median nerve, that is the root value C6 and C7, and the main function of pronator teres is pronation and flexion of the forearm. So, if any muscle is helping in movement of maybe a little bit movement or partial movement, it will be the part of that joint movement, like pronator teres, helpful in the flexion of the forearm. How, that we will discuss in the picture. So pronator teres is a muscle having origin from the medial epicondyle of the humerus and ulna, attached to the lateral aspect of the shaft of the radius, supplying median nerve and pronation of the function. Flexor carpi radialis. Flexor, as the name is indicating, it will perform the function of flexion. Carpi, going towards the carpal bones or attached to the carpal bones, and radialis means it is towards the radial side, arising from the medial epicondyle of the humerus, going towards the basis of second and third metacarpal bones, so arising from the humerus and going to be attached to the carpal bones on the radial side. That's why it is known as the carpi radialis. The nerve is same, median nerve, and it flexes and abducts the hand at wrist because it is attached to the lateral side. So when it contracts, it will radial deviation will take place for its movement. flexion and abducting at the wrist. Another muscle, palmaris longus. It is a very have a long tendon and a small belly, but it is a very important muscle. In 14 people, it is absent. Have the same origin with the epicondyle of the humerus, and it is attached to the flexor reticulum and palmar aponeurosis. So in the diagram, we will see the flexor reticulum and palmar aponeurosis. The nerve is median nerve, and it flexes the hand. Then we have a muscle which is known as flexor carpi ulnaris. So the same way we have radialis, we have ulnaris. Function will be the same, flexion going toward the carpal bone, and it is on the ulnar side. It has two heads, humeral head from the medial epicondyle of the humerus and ulnar head from the collicular process the ulna, and going towards the carpal bones, that is pisiform, hook of the hamate and base of his metacarpal bone. This muscle is supplied by ulnar nerve. So that is a variation. Many muscles or most of all of the muscles of the anterior compartment forearm are supplied by the median nerve, with the exception of flexor carpi ulnaris that is supplied by the ulnar nerve. And function is flexion, adduction, hand and wrist. Then below them is a muscle, or in between them a muscle which is known as flexor digitorum superficialis. Flexor, it will flex. Digitorum, it will go to the digits, so it will flex the digits. Superficialis means there is also a muscle which is deep, that is profundus. Because we have two muscles for the digits, the digitorum superficialis and the digitorum profundus, so they are named according to their arrangement. Flexor digitorum superficialis is coming, its humno-ulnar from medial epicondyle of the humerus, medial border of the coronal fossa of the ulna, and also some part of the shaft of the radius, and going to the middle phalanx of the medial four fingers that we will see in the diagram. Median nerve is supplying them, and they will flex the middle phalanx of the finger and assist in flexing proximal phalanx at the end. How, that we will discuss. Flexor pollicis longus, pollicis for the thumb, anterior surface of the shaft of the radius, it is coming, going to the distal phalanx of the thumb. When we have a longus in a muscle, it means it is going toward the distal end, so distal phalanx of the thumb. Again, they are supplied by median nerve, but through its branch, which is known as anterior interosseous branch, and flexes distal phalanx of the thumb. Flexor digitorum profundus, which is just like superficialis, anterior medial surface of the shaft of the ulna, going toward the distal phalanx of the medial four fingers. Here it has a variation. Its medial half or medial two slips are supplied by ulnar nerve, and lateral two slips are supplied by median nerve, and flexes the distal phalanx of fingers and assists flexion of middle and proximal phalanges. And the last muscle for this region is pronator quadratus. Anterior surface of the shaft of the ulna is the origin point, and it is going towards the anterior surface of the shaft of the radius. It is a quadratus, means it has four-sided quadrilateral in shape and going from ulna towards radius. Again, it is supplied by the anterior social branch of median nerve, and it is pronator of the forearm. So these all are the muscles. So now we will go one by one. Now we have talked more and more about the medial epicondyle of the humerus is giving origin to the many muscles. So that is known as common flexor origin. Common flexor origin means medial epicondyle of the humerus. So pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and then flexor carpi ulnaris. These all muscles have a same origin from the same point, that is known as common flexor origin, that is from the medial epicondyle of the humerus they come. So the first muscle we have discussed is pronator teres, rising from the medial epicondyle and going towards the radius. A little bit oblique muscle. So this is our first muscle, pronator teres. The second muscle which is arising from the medial epicondyle on the lateral side, its name is flexor carpi radialis, as you can see. The second muscle going towards the radial side. The third muscle, which is small belly and long tendon, is palmaris longus. And as I have told you that near the wrist we have a band of connective tissue. It's just like a ribbon of the band of a connective tissue which is present over here just below the skin of the wrist. What it do? It keep all these tendons in position. This is known as flexor retinaculum. Because it is present on the flexor side, that's why it is known as flexor retinaculum. All the tendons are passing below the flexor retinaculum. Only the palmaris longus is the muscle whose tendon, when it reaches there, it attached to the flexor retinaculum and then spread out and form palmar aponeurosis that we are going to discuss in the next lectures. That is palmar aponeurosis. After palmar aponeurosis, we have flexor digitorum superficialis, little bit overlapped by the flexor carpi radialis and palmaris longus, and again it is passing through flexor retinaculum, and the final is flexor carpi ulnaris, which is toward the ulnar side. So these are the superficial muscles of the anterior compartment: pronator teres, most lateral, then flexor carpi radialis, then palmaris longus, then flexor digitorum superficialis, and most medialis flexor carpi ulnaris. So now, if we talk about one by one, those muscles which are only flexing at the wrist: flexor carpi radialis, palmaris longus, and flexor carpi ulnaris. As you can see, the flexor carpi radialis is attached to the metacarpal bones, and flexor carpi ulnaris is also attached to the pisiform hook of the hamate and fifth metacarpal. It is attached to the fifth metacarpal, and flexor carpi radialis is attached to the second and third metacarpal. And this is our wrist joint. The rule is when a muscle is crossing a joint, it will act on that joint. So just after crossing, it is attaching to the bones. So these are the flexors of the wrist. They will not do any movement of the digits because they are not attaching to the digits. They are only attaching to the metacarpal bones. So flexor carpi radialis attached to the second and third bases of the metacarpal. Flexor carpi ulnaris to the fifth base metacarpal plus of the hamate pisiform, and palmaris longus is blending with the flexor reticulum. So they all are crossing the wrist joint. So they all are the flexors of wrist. Now, flexor digitorum superficialis. This is important because it has a origin from the common medial epicondyle common flexor region and also from the radius shaft. It moves from both the heads unite together and form the belly of the muscle, and the belly becomes a single tendon, and that single tendon just at in front of the wrist divisible into four slits. These are the four slits of flexor digitorum superficialis. Each slit is passing towards its corresponding digits. So they move forward and they attach to the middle phalanx. This proximal phalanx over here. They slip around the middle base of the middle phalanx. Because they are reaching till the middle phalanx, they will not only act on the wrist because their joint muscle is passing from the wrist, so it will act on the wrist as well as it is passing from the interphalangeal joint, so it will also act on the proximal interphalangeal joint and flex the digits, the middle phalanges. That is the flexor digitorum superficialis. So when you remove flexor digitorum superficialis muscle, if you cut flexor digitorum superficialis, below you will see the muscle, which is a muscle of the deep compartment or deep muscle of the anterior compartment known as flexor digitorum profundus, arising from the common flexor region plus from the radius annulum, and it has the same division. It also divides into four slits, and these four slits will pass corresponding digits and they reach to the base of the distal phalanx. So superficialis is reaching till the middle phalanx basis, and flexor digitorum profundus is reaching toward the basis of proximal, the distal phalanx. So flexor digitorum profundus is responsible for the flexion of the middle phalanx, proximal phalanx as well as the distal phalanx. So combinedly they act together when we make a fist. So flexor digitorum superficialis is mainly acting on the middle and proximal, and digitorum is mainly acting on the distal, but they are also acting on the middle as well as proximal, as well as metacarpophalangeal joints to flex them. So This is a deep dissection showing the flexor digital profundus. Along with flexor digital profundus, you can see flexor pollicis longus muscle, which is arising from the ulna and going downward, and it is attaching to the distal phalanx of the thumb. So it is the main flexor of the thumb. So thumb has a separate flexor known as flexor pollicis longus. If we remove these two muscles also and go further, then we will see the muscle which is known as pronator quadrator. It is the most deeper muscle from attached to the radius and the coordinate in shape. So when we perform the movement of supination and pronation, this is the long axis on which we move. Why? Because ulna, as I told you, never move. If you see ulna remain it's on its position, only the lower end of the radius while we are doing pronation rotate anteriorly over the ulna lower end and come toward the medial side. So in normal anatomical position, radius lower end distal end is on the lateral side and ulna on the medial side. But when the movement of pronation takes place, lower end of the radius moves anteriorly from ulna toward the medial side. So the pronation muscle which is starting pronation or powerful pronator is pronator quadratus, supported by the muscle which is known as pronator teres. So two muscles are responsible for the movement of pronation: pronator quadratus as a main and supported by the muscle pronator teres. And supination is done by two muscles. One is known as supinator muscle, which you will study in posterior compartment, as well as biceps brachii. Already we have talked about it forearm arm lectures. So biceps brachii is the main supinator of the forearm. This is another diagram showing the pronator teres and pronator quadratus. It is almost superficial and this is very deep. And by the movement of pronation, you can see how much they move, and the pronator quadratus also move around and contract and take the lower end of the radius to the medial side. That is pronation. And this is the supinator. So when the supinator contracts back, it will, along with the biceps brachii, it will take back to the supination position. So biceps brachii and supinator are the supinators, and pronator teres and pronator quadratus are the. That all about the anterior compartment of the forearm. The arteries of the anterior compartment are radial and ulnar arteries, and the nerves are median and ulnar nerves. As we have discussed, all the muscles of the anterior compartment, separation and deep, are supplied by median nerve, with the exception that the flexor carpi ulnaris and medial two slicks of flexor superficialis are supplied by ulnar nerve, and rest of the muscles are supplied directly by the median nerve or through its branch which is known as anterior interosseous nerve. That is the radial arteries. Brachial artery from the arm, which is to the cubital fossa, divided into two branches known as radial artery and ulnar artery. Radial artery runs towards the lateral side, and ulnar artery runs towards the medial side, and they mainly supply the forearm anterior compartment. But ulnar artery is mainly responsible for, when you will talk about the neurovasculature, you will talk more about it. These are the nerves. The median nerve, which is the main nerve of the anterior compartment of forearm, supported by the ulnar nerve, which gives supply to the flexor carpi ulnaris and medial two sets of flexor digital articulations. And in the last, regarding the cutaneous supply of the anterior compartment, we have two nerves: lateral cutaneous nerve of the forearm, which is also known as lateral antebrachial nerve, and lateral medial cutaneous nerve of the forearm. These are the two nerves which are supplying the skin for general sensation to the anterior compartment of the forearm. Lateral cutaneous nerve of the forearm and medial cutaneous nerve of the forearm. And the root values you can see C5, C6, C7 for the lateral cutaneous nerve of the forearm and C8 and D1 for the medial cutaneous nerve of the forearm. Already you talked about in the lecture of brachial plexus about these nerves. This is all about the anterior muscle, compartment muscle of the wrist, forearm, and acting on the wrist and flexing the wrist. Thank you very much.